Good morning everyone. Myself Mayuri, a second year MBBS student. Today I'll be discussing about the Parkinson's disease. Coming to the introduction, Parkinson's disease is a progressive nervous system disorder that affects movement. Symptoms starts gradually, sometimes starting with a barely noticeable tremor in just one hand. Tremors are common, but the disorder also commonly causes stiffness or slowing of movement. Parkinson's disease. Parkinson's disease is a chronic, progressive neurodegenerative disorder characterized by slowness in the initiation, execution of movement, bradykinesia, increased muscle tone, rigidity, tremor at rest, and gait changes. Coming to the etiology, exact causes unknown. It might be hereditary, family history, having one or more close relatives with the disease increase the rise of getting. Advancing age, above 60 years mostly seen. Sex, male are more likely to get than female. Low estrogen level, most menopausal women who don't use hormone replacement therapy are more risk of getting the disease. Medications like metoclopramide, reserpine, methyl-dopa, lithium haloperidol and chlorpromazine, agriculture work, exposure to environmental toxins such as pesticides, herbicides, head injury. Pathophysiology, degeneration of the dopamine producing neurons in the substantia nigra of the midbrain leads to disruption between the normal balance between dopamine and acetylcholine in the basal ganglia, impaired extrapyramidal tract controlling, which leads to loss of motor control, which leads to tremor, rigidity and akinesia. This is a picture where it shows how a normal physiology functions, and in Parkinson's disease how the substantia nigra, how the activity goes in the neurons. Next comes to the clinical manifestations. Rigidity. It is defined as an increased resistance to passive motion, cogwheel rigidity. Jerky, ratchet-like resistance to passive movement and muscles alternately tense and relax. Tremor. It is an involuntary oscillation of body part. Parkinsonian tremor is described as resting tremor as it is typically present at rest and disappears with voluntary movement. It manifests as pill rolling tremor of hand. Akinesia. What is akinesia? Akinesia is nothing but the absence of the movement. Moments of freezing may occur and are characterized by sudden break or block in the movement. Hypokinesia. Hypokinesia is a reduced amplitude of the movement. Postural instability. Postural instability is common. Patients may describe being unable to stop themselves from going forward, that is propulsion, and going backward, retropulsion. Symptoms of Parkinson's disease. Hypomimia, drooling of saliva, low volume speech, dysarthria, problem with swallowing and involuntary flow of saliva, longer time to complete a task, stiff face in advanced PD, altered cognitive function, that is dementia, disorder of intellectual function. Complications. These include motor symptoms like dyskinesia, dementia, depression, hallucinations, psychosis, dysphagia, malnutrition, aspiration in pneumonia, orthostatic hypotension, and risk for fall. Diagnosis. Diagnosis is based on the clinical features, CT scan or MRI of the head to rule out secondary cause, PET scan to evaluate levodopa uptake and conversion to dopamine in the corpus striatum. Anti-Parkinsonism medications. Levodopa, L-dopa. It is the most effective agents and the mainstay of the treatment for controlling the symptoms. Sinemet. It is made up of levodopa and carbidopa. Levodopa enters the brain and is converted into dopamine, while carbidopa increases its effectiveness and prevents the side effects of levodopa such as nausea, vomiting. Dopamine receptor agonist. These are the drugs that activate or stimulate the dopamine receptors, ergot derivatives such as bromocriptine or pergolide, and non-ergot derivatives such as ropinirole and pramipexole. Monoamine oxidase inhibitors. It blocks the breakdown of dopamine and are used primarily to treat motor fluctuation associated with levodopa treatment. Most commonly, drugs used are selegiline and rosagiline. Drug and their mechanism of action. Dopaminergics, dopamine precursors, levodopa or L-dopa, carbidopa, converted to dopamine in basal ganglia. Dopamine receptor agonists, pramipexole, ropinirole, rotigotine. They stimulate the dopamine receptors. Dopamine agonists, amantadine, apomorphine, binds NMDA type glutamate receptors, increase dopamine release and blocks dopamine reuptake. stimulates postsynaptic dopamine receptors. Anticholinergics such as benzotropine, trihexyphenidyl blocks cholinergic receptors, thus helping to balance cholinergic and dopaminergic activity. Antihistamines such as diphenhydramine has anticholinergic effect. Monoamine oxidase inhibitors, rasagiline, safenamide, selagiline, they block the breakdown of dopamine. Catechol O methyltransferase inhibitors, entacapone, tolcapone, block COMT and slow the breakdown of levodopa, thus prolonging the action of levodopa. Surgery. Surgery is optional only when medicine doesn't make the symptoms better. Thalatomy. It is a surgical procedure in which opening is made into the thalamus to improve the overall brain function. Deep brain stimulation. Pulse generator high frequency electrical impulses to the thalamus and block the nerve pathway to control the tremors. Coming to the deep brain stimulation. Deep brain stimulation can be used to treat the tremors and uncontrolled movements of Parkinson's disease. Electrodes are surgically placed in the brain and connected to a neurostimulator, that is a pacemaker device in the chest. Physiotherapy. A combined approach of physical therapy and pharmacological intervention plays a key role in the management of the patient. Physical therapists should be fully aware of the medications the patient is taking and its potential adverse effects. Optimal performance can be expected at peak dosage, whereas worsening performance is associated with end of dose cycle. Exercise training, strength training, balance training, correcting eating impairments, verbal skills, practice with breath control. This was all about Parkinsonism. Thank you.